Um, and I was just reviewing what it is. It's basically, I was saying that it's like our cousin is the physical therapist, and we learn all the same things that they learn. And basically, we help people learn to function within their environments. So if they're learning to get strong again after a disability or an injury, we're going to help them not just learn to lift something 20 times, but we're going to help them learn how to lift their backpack to get it back on their shoulders again, so they don't have to have somebody help them, or have somebody to be able to open a jar of food on their own with like strength and independence, rather than have a nurse or somebody help them. Okay, so that's basically what you're seeing on the screen is what I was just describing. We help people with activities so they can live independently. We work with any age group in a variety of settings. So wherever somebody is struggling to function within a certain environment, we're there to help them. And while we're medically trained and we're a healthcare service, OTs are very holistic. So we don't just look at how many times you can squeeze something with amount of pressure. We're going to look at the whole picture. So if somebody is depressed because of a disability, we're going to help them through that. We work with social workers, psychologists, physical therapists. We just work with a broad spectrum of people, so that way our clients can make progress. Okay. So for schooling for OT, currently occupational therapists need 6 years of college to get a master's degree to start working. When I was in college, it was only 4 when I graduated, but I have since gone back to school and earned different degrees. A lot of OTs do choose to go back to get a doctoral degree, which is what I did. And it would require 2 more years of school after your master's. Right now, OTs don't need that degree to go out and start working after college, but it's kind of in the works for the next few years. Physical therapy requires a doctoral degree in order to start working. And part of college, you would do a field work. It's like an internship. And your school puts you in different settings, like a hospital for 3 months, and you follow an occupational therapist around there and learn what they do. And eventually you get very hands-on with the clients and you learn how to do it hands-on, basically training. Okay, and the types of things that you're expected to learn in an OT program in college are your basic liberal arts. So you have English, math, psychology, sociology, and then a lot of sciences. I did a lot of chemistry, physics, and biology. And that's just every year you're in school, it just keeps layering on top. Lots of anatomy and physiology, pathology, which is studying diseases and different disorders, because you're going to see a lot of different things out there, and stuff that you may never see, but you still have to learn about it. And you'll take courses that are related to occupational therapy. So when you're out there, you're going to need to know about pediatrics, aging adults, clinical rehab, mental health, and documentation. So that's just writing really good notes so that insurance companies cover your services, or if anything ever goes to court, you have to learn how to document everything perfectly. That's a very important course that you have to take. Okay, and what I have chosen to do is go into pediatrics. So right now, for the last, not right now, but the last 23 years, I've worked in an elementary school in that setting. But you could work in early intervention, where you work with babies, basically, and you see things like cerebral palsy, autism, developmental delays, which would just be something like a baby is not sitting up on time, not taking those first steps the first time, not putting their hands to their mouths on time. And usually you work in the home and sometimes a hospital. So if a baby has had surgery or is just born very prematurely and is spending a lot of time in the hospital, you would work in there and you'd help them learn to get strong or do different movements just to help their bodies kind of develop. And in that setting, you work very closely with families and their caregivers, because when they take the baby home and you're not there, they have to know what to do to help them progress. And the next level up from that is working with preschoolers. Same kind of diagnoses. You start to see more learning disabilities in this section. And you work in preschools, nursery schools, sometimes the home. And again, you work alongside teachers and parents. Now, what I do, I work in schools. This is where kids are from kindergarten up to 21 years old. And the reason it's 21 years old is because if there's a child with a disability, the law says that they are entitled to stay in school until they're 21 years old. So they get the most amount of education that they can possibly get and all the supports that they need before they branch out into adulthood. We usually see cerebral palsy, a lot of autism, developmental delays, learning disabilities. And when we're in the setting, we go right to the child's school and we work in the school and we work alongside teachers and parents. You always have to work with everybody in your team because it doesn't really help the child if you don't do that. OTs, no matter where you are, no matter what setting, nursing home, clinical rehab, you have to perform evaluations. And they're basically tests to see what areas of weaknesses your clients have that are preventing them from functioning independently. So we would look at strength and range of motion, which is how much motion you have in your joints, how far open like your elbow goes. Fine motor, which is using your fingers and hands. Visual skills, kind of like hand-eye coordination. And once we know which areas are weak, then we develop a plan to improve that. And that is called the treatment plan. And it's just basically goals that you and your client develop that are important to them. Now, of course, you're not going to talk to a baby and ask them what's important, but you talk to the parents. And you develop goals. Usually they're within months or weeks. And once they work on activities and gain their independence, then they get discharged. So an example of a goal for, say, for a high schooler, Mary will be able to use her thumb, index finger, and middle finger to turn the dial on her locker without assistance. So that would be a meaningful goal for a high schooler, because who wants like somebody an adult trailing behind you to help you open your locker? I mean, that would be a meaningful goal for somebody who might be a teenager. When, like I said before, when the client reaches their goals, it's up to the OT to decide if you need to discontinue or keep going. All right. And OTs in the schools, we basically do everything to get the kids strong, have good fine motor skills. Part of fine motor is handwriting, visual perception, hand-eye coordination. All of these things are needed for students to function throughout the day. If they don't have these skills, then they have difficulty accessing their books, accessing their lockers. Little kids can't color and learn how to write. So it's preventing them from functioning within that environment. So those are the areas we address. And it looks like play, even up through high school. We do, the kids are really working now. So to address balance and coordination, this example I have, you could play Twister or do an obstacle course. And then for hand strength and fine motor, we do Play-Doh, we do beads, we do a lot of games with finger activities, Legos, things like that's for little kids. But for older children, we would do more age-appropriate things. We would have them open the lock on their locker, do their backpacks, do their zippers. Depends on the child's disability and where their weaknesses lie. And we're prepared, and a lot of children that I work with in high school, we do a lot of job preparation. So say they're going to learn how to be a chef or something like that when they get older, we're going to help them have the strength in their hands to hold a knife or to read a recipe, to follow a chart, those visual skills, all of these things coming together so they can have a functional, independent job when they get out of high school. So there's a lot to it. So even though we work with elderly clients and other types of populations, the idea is always the same. We work with the client to determine what is meaningful to them, and we use that to help them gain their independence. And there's one thing that OTs have to remember is that what you as a therapist may find meaningful, it might not be meaningful to the client. So you have to be always aware of you're pushing your viewpoint onto them. But of course, you can always make a clinical judgment and say, well, you may want to drive, but you're 75 and just had a stroke. So let's work on some other skills to build up to the driving. Like you have to use your clinical reasoning to decide, well, it's not appropriate yet. And we'll work towards that. That would be a goal on the treatment plan. And OTs become attached to their clients. You get so involved with them personally. You know what's interesting to them. You know what's meaningful for them. You go in their homes. We learn so much about them. And sometimes it's hard to discharge them because, you become family sometimes. And it really helps the therapeutic process. But you also have to learn like when to pull back and it's too much. You don't want to be telling them what that dinner last night or, gosh, my husband didn't clean the house. Like that's when it becomes too personal and you have to cut the tie there. Well, we do have a lot of overlapping similarities.
Yeah.
We all took the same courses in college. We took the same anatomy and physiology. We have to learn it all. But whereas a physical therapist is interested, like a goal for a physical therapist for their client would be 20 reps, like bicep curls, or be able to stand up for 20 minutes without falling over. We're going to take that a step further and say, well, Mrs. Smith is going to be able to lift her arm 20 times. So that way she can pick up shopping bags and take them to the house by herself without a nurse helping her. So we're going to layer on that function part of it. So it's not just like, okay, you can do 20 reps now, you're free, you're discharged, you go home now. Now we're going to make sure you can take that skill and apply it to something. So I work in a public school in Baldwin, in an elementary school. I've been there for the last 10 years, but prior to that, I've been in high schools, middle schools, but I've settled in this one building. I basically show up at the start of the day, and in the beginning of the school year, I get a very large list of students who need therapy in the building that year, and I make a schedule, and I usually see children once or twice a week. So I make my schedule. I know their room numbers. I walk down to their room. I take them into the OT room and I work with them. We do the activities on their treatment plans. We work towards their goals. And then I would bring them back to class. And sometimes I work in the classroom with the very impaired children. So there's a lot of students who are really having a hard time, with autism or something like that. So in those cases, I work with the whole group in their classes, and it's not a big class. And we do functional things like learning how to cook, learning how to fix something, like sew a button back on if something breaks. We do a lot of functional things. So and that's it. I just back-to-back students all day. And in this setting, you call them students, you don't call them clients. And then I go home. In fact, the last 3 years, I'll just give you an example. We had a student, he's now in the middle school in that district. He had 3 diagnoses. He was blind, he had autism, and he was learning disabled. So he had a really hard time, and we could never get him to do anything. Like he just didn't want to, but he loves music. So we took that meaningful thing for him and we taught him. He wouldn't use his fingers for anything. He wouldn't write, he couldn't really write because he couldn't see, but he couldn't use his Braille typewriter. So we worked with the mom and we got him set up with piano lessons, and that got him to use his fingers. His posture improved, his arm strength improved, and then he was able to address a lot of the goals that we had for him in school. So that was, it's tough, but when you work with the parents, work patient, like you said, if you're patient and take their interests into consideration, you do make some progress. And he did make a lot of progress. It was really great. Oh, there isn't. There is another degree that you can get to be an OT assistant, and that's only 2 years of schooling, but you don't get paid as much and you have to do all the same work. And you basically have to listen to somebody like me telling you what to do, and you've had, but people go from there and then they continue on and get there. Yes, in New York, it is very typical, at least for when you're working in schools. School districts don't want to pay for your malpractice insurance. I have to carry $4 million malpractice policy. They don't want to pay for the premium. They want to pay for a lot of things. So they usually hire an agency that brings in the therapist. But if you work for a hospital, you work directly for the hospital. If you work for, a private school, they're going to hire you on staff. Public school doesn't do that. School will help you.
Oh,
They usually have contracts with different facilities, to get, I have had students come and shadow me to watch what I do. And it's, you never have to go out and find it yourself. Well, what I had done my senior year of high school was I basically just observed at a clinic and I watched what was going on. I was interested in physical therapy or occupational therapy or speech therapy. So I just went and I observed some, sessions. I got permission to do it from the parents, because you have to, with privacy laws, you have to make sure that, it's agreed upon by whoever's being watched. You can't just go in and watch them get their treatment. But I would just observe and see if that's the kind of thing you like to do. No, as long as you go through college and get the right degree, you'll get a job. You can get certified in different treatment approaches, different styles of treatment. You can get certified in different types of special evaluations, but you have to sit for a course and, you take a test at the end and they say, yeah, you're certified to do this. And that's about it. And then every 3 years, you have to do continuing education credits to keep your license and your national certification current. And if you don't, you get audited and they take your certification away. It's 36 continuing education credits. It's not college credit. It's just, you read an article and you answer some questions and you keep doing that till you hit 36. And I think I fell into the right field. I think it's a perfect suit. It's suitable for my personality. And I probably would have been a good physical therapist too. I also wanted to be a pediatrician, but I didn't want to go through all that schooling. I wanted to start a family. So I didn't want to waste time on that. It was speech therapy.
Very easy.
It is. And the schools are very stringent. You could enter your freshman year of college with 300, 500 kids in your occupational therapy program. And by your 3rd year, they probably are down to about 150 kids. They have a lot of rules that you have to have really good grades, and they just kind of siphon off the good ones and keep them. And if you don't make it, then I don't know, who didn't make it in the 3rd year.